Today's episode is dedicated to observing World Cancer Day, which falls on 4th February, a day when we stand united in the fight against cancer. So it is also a day to reflect on the burdens cancer places on individuals, families, and communities worldwide, and to reinforce our shared commitment to improving awareness, prevention, and treatment. Joining us today are two esteemed medical professionals who are at the forefront of the fight against cancer. We have Dr. 𝐂𝐚𝐧𝐜 𝐂𝐚𝐲, a gynecologic oncologist, and Dr. Prabhat Pradhan, who is an oncosurgeon from GDWNRH. And together they bring years of knowledge and experience in cancer care, and we hope to discuss some of the relevant diagnosis, treatment, and the importance of early detection. So thank you so much, Dr. 𝐂𝐚𝐧𝐜 and Dr. Prabhat, for joining us today. So to begin with, I'll ask Dr. 𝐂𝐚𝐧𝐜 to give us brief account of the importance of celebrating or observing World Cancer Day, followed by its theme this year.
Thank you, Thewa, for having us on today's talk show on the 25th World Cancer Day.
Yes.
This year it is 25th year. And before I go on to talk about the theme of this year's World Cancer Day, I would like to share some incidents in the worldwide. So if you take both the male and female together, the incidence of cancer across the globe is 20 million in 2022, and the mortality, the death, was 9.7 million. And if you just take the females, the incidence was 9.7 million, and out of that 4.3 million deaths. And if you come to Bhutan specifically, in 2014 the number of cases was only 468, and over the years it has increased, and in 2022 the number of cases was 819 cancer cases. And if we take together for last 5 years, from 2019 to 22, there were 3,172 patients who were diagnosed as cancer. Out of that, 1,461 died. These are the local incidents. And if you take in female, the commonest cancer is cervical cancer, which accounts for around 16%. Next is stomach cancer, which accounts for around 15%, followed by breast cancer, lung cancer, and ovarian cancer. Now coming to the theme of 2025, 26, 27, for next 3 years, it is united by unique, meaning every cancer patient, they have a different stories to share, different pain, different experience, different aspirations, hopes. So in that way, every case, though they are diagnosed to have the same cancer, cervical cancer, their experiences and aspirations are different, making them unique. And all of us, health professionals, relatives, friends, communities, government, everyone should come together to fight against the cancer. So for next 3 years, we are going to be united for the unique challenges.
Thank you so much, Doctor, for giving us the brief account of cancer incidences in the country, followed by theme for this year's World Cancer Day. So to Dr. Prabhat, to our viewers who are unaware of what actually is cancer, can you give us a brief account on what actually is cancer and explain the stages, their stages?
So what is cancer? In a simple term, we have a cell that functions by itself and controls our body. Normal functioning of our body is done by the cells. When you go deep down, it has genes. The genes they have their own functions. They function. The cells function. They for some time, and they die. They are replaced by another normal cells. But in certain because of certain condition, these cells are damaged, their genes are mutated, they are damaged. So what they do is they keep on multiplying. They don't die. Body doesn't throw that cells away, but it keeps on multiplying. So it is uncontrolled, non-functioning. There is no function of this one, but it keeps on growing. So it occupies the space in the body and gives a lot of other problems, like it spreads to the body, it destroys our normal functioning. So that is, in the simple term, the cancer. What is cancer? So there are 4 stages of cancer. The stage 1, which is very early, there is no signs and symptoms manifested when there is early lesion, very small lesion. So that is stage 1. So when cancer is little larger, we call it stage 2, but it is within that organ only. But stage 3 means it has come outside, almost outside the body. The size is also big. So when it is stage 4, then the cancer cell has gone to other parts of the body also, like in the brain, bones, liver, lungs and all, and it destroys whole body. Is a systemic disease, then it becomes a systemic disease. So that is the stage of the disease.
Yes, doctor. So Dr. Namka, since you are specialized or you look after the gynecologic cancers, what common cancers are within those range? What are the common cancer that you encounter in your practice?
In Bhutan, when
of course, besides cervical cancer that you mentioned earlier.
In Bhutan, the commonest cancer is cervical cancer, which I said it accounts for around 16%.
Yes.
The next cancer is ovarian cancer, followed by uterine cancer, and we do get a cancer which is called molar choriocarcinoma, which is as a result of pregnancy related, and rarely we do get vaginal and vulval cancer. So the commonest is cervical cancer, and we are mostly focused on cervical cancer because cervical cancer is 100% preventable and 100% curable.
So again, to Dr. La, since you mentioned that cervical cancer is the most commonest cancer in women, so what are some of its typical signs and symptoms, or maybe firstly begin with its causes?
Cervical cancer, the most important cause is persistent infection with high risk human papillomavirus infection, papillomavirus, and it is important to know that the HPV types, there are more than 200. All of this does not cause cancer. Around 80% of this regresses spontaneously, and only 10 to 15% that persist. And out of that, the persistent infection, which is around 12 varieties of HPV, this is responsible. And to get this persistent HPV infection, there are some risk factors like early age at marriage, early age at sexual intercourse, multiple sexual partner, the unprotected sexual intercourse, multiple childbirth, and those who have not received HPV vaccination, or those who have not come for HPV screening or cervical cancer screening, and those who are smokers, and those who are immunocompromised, especially the people with human HIV infection. So this group of people are at high risk of getting cervical cancer.
So, doctor, is there a specific age group that are more susceptible to getting cervical cancer?
So there are something called peak age at cervical cancer. There are double peak, so age between 35 to 45 and 55 to 60, around that age. But as long as you have cervix, even if you have no risk factors, you are always at risk of getting cervical cancer. And if you have those risk factors which I have mentioned, you are at high risk of getting cervical cancer.
So, doctor, how do we know that we have cervical cancer? Since Dr. Prabhat clearly mentioned that the initial stage of cancer doesn't show symptoms, it is asymptomatic. So, how do we detect cervical cancer?
So, the cervical cancer in its early stages or precancer stage, it is mostly asymptomatic, meaning there are no symptoms. But those patients, some patients with the precancer and early stages, the commonest symptoms are postcoital bleeding, meaning bleeding during or after sexual intercourse, then foul smelling vaginal discharges, then intermenstrual bleeding, bleeding in between the menstrual cycle, or prolonged menstrual cycle. Other one is post-menopausal bleeding, meaning once they have menopause at around age of 50, and after 1 year, if they have even a slightest blood coming from the private part, this may be one of the early symptoms of cervical cancer. And once the cancer stage has gone up, there will be other symptoms like pain in the pelvis, back pain, then urinary symptoms, symptoms related to passing urine. And if it has gone to other parts of the body, like in the lungs, when it has reached to stage 4, the patient might come with a persistent cough, which may or may not have blood stain. And if the patient, the cancer has gone to the lungs, liver, the patient might come with jaundice, loss of appetite, and if gone to the brain with seizure attack. So the late stage manifestation, apart from the local symptoms, it will have symptoms that is related to the organ which is affected.
Yes. So doctor, before going on to the diagnosis and treatment options available, I'd like to ask Dr. Prabhat, what are the common cancers that you encounter in your practice lab?
In my area of practice, in Bhutan, most common cancer is stomach,
Yes.
because of the risk and factors that are present in our population. Then followed by, in my practice, is colorectal cancer, then breast cancer, esophageal cancer, lung cancer, and liver cancer. Those are the common ones that I face in my practice.
Yes. Since we have limited time, can we maybe have a brief account on the causes, signs and symptoms of the most commonest cancer, that is stomach, in your area of practice law?
So the most common is stomach cancer. So actually this has to be clearly mentioned that there is no specific sign for the cancer.
Yes.
You have this one, it is definitely because of the cancer. It's not like that.
Mm-hmm.
The only thing is that another aspect we have to consider is the age. If young person, 15 years old patient, boy comes to me and says, whatever you narrated in BBS, I have that symptoms, it doesn't mean that he has a cancer. But if 50 years old man comes to me and says, I have all these symptoms, maybe he has a cancer and he has to be checked. So other risk factors, when you talk about the risk factors now, risk factors are common for all the cancers, like cigarette smoking, then chewing tobacco, doma and all, then our lifestyle, less of exercise, no vegetables or fruits in the diet. If as you grow older, then this is also a risk factors. Your BMI, if your BMI is high, then you have the risk factors.
Yes.
Those are the commonly risk factors that are we have in our population.
Yes. So doctor, getting back to the diagnosis of cervical cancer, what diagnosis options are available in our country?
Before I come to answer your question,
Yes.
I would like to share some information from Bhutanese aspect.
Yes.
So, you know, there are around 23% of cancer which is related to smoking.
Yes.
That means every 1 out of 4 patients, they have history of smoking. That's lifestyle related. And if you look at Bhutan's National Health Survey report 2024, 40.2% of Bhutanese population are taking alcohol
Yes.
at that moment of time, and 45.4% of women are taking bitter nuts. So this is the cancers are mostly lifestyle related amoeba.
Mm-hmm.
And if you now coming to cervical cancer, as I said, the most important cause is infection with high risk HPV infection, and in Bhutanese context, the infection rate is around 11.2%. So now to diagnose cervical cancer, so what we do when they are asymptomatic, we have something called screening test, HPV DNA screening, and if the screening test is positive, we subject the patient to what we call colposcopy, and based on colposcopy, depending on whether it's normal or abnormal, we do biopsy from the cervix. So cervical biopsy can be like taking a small tissue or a larger tissue under some form of anesthesia. So this, for any cancer to diagnose, histological diagnosis, the tissue diagnosis is very important. So cervical cancer, not only cervical cancer, any cancer, we need to take biopsy. So there are different ways of taking biopsy. For cervical cancer, it's cervical punch biopsy or lip. biopsy. So without this histological diagnosis, we cannot start treatment for any cancer. That is for general, with any sort of cancers.
Yes. What about the treatments? What options are there for individuals with cervical cancer?
In Bhutan, we have all the treatment options available,
Yes.
meaning that if the patient comes in the early stage, when they are in operable stage, we provide all the surgery types. There are different types of surgery. And if the stage is beyond surgery, then we provide radiation therapy. The service is not available in the country, but the Royal Government of Bhutan gives the referral to India, and they get all the treatment. And we have chemotherapy. Chemotherapy is available within the country. And recently we have started palliative care, so which is very important. And in my experience, especially when it comes to cervical cancer, more than 80% of the patients in Bhutanese context, they come in the advanced stage when we are not able to provide the curative treatment. So we provide the alternative treatment that is called palliative care, which is a wholesome care.
So the survival rates of cervical cancer in the country is comparatively low in Memula.
So it would depend
Yes.
on the stage of diagnosis.
Yes.
So if the stage is advanced, like stage 3, 4A, 4B, any country, the survival chance is quite low.
Yes.
But
Yes.
still we can treat them.
So Dr. Prabhat, similarly, what are the diagnostic options and treatment options available for stomach cancer?
So when it comes to diagnosis, the number one modality is endoscopy.
Yes.
So we put a pipe with a camera that's called endoscope. We put inside the body and look all the entire stomach, whether stomach is harboring any ulcers or not. If there is a suspicious lesion in the stomach, then we take biopsy. Then biopsy will tell us whether there is a cancer or whether it is because of benign lesion. And treatment-wise, what Dr. Nangka said, similar. But the recent advances in our stomach cancer is now, if the lesion is very small, like 1 centimeter, we have the option of doing the surgery through the pipe only, through endoscope only. We don't have to cut our stomach, cut open the stomach and do major operation. So that is for the stage 1 disease. Suppose stage 2 and stage 3, then we need to do a proper operation, major operation, followed by the chemotherapy. And when it comes to stage 4 disease, then there are not much of options. We can try palliative options like chemotherapy, then palliative. If they are not able to eat, because cancer is so big that patient is not able, the food doesn't go below the stomach because cancer is blocking the tract. So in that case, we can do the bypass, like from the, can join the intestine and the stomach, then bypass this block, and at least patient can have food. And another is the complication what they can have is bleeding and all. So for the bleeding also there are a few options that we can do. Those are the palliative options. And if they have severe pain and all, we have a medicine to reduce the pain and suffering, so that even though they have a stage 4 disease, they can lead a normal, painless, less of suffering.
Yes. So, Doctor, in continuation to that, are there any main challenges that you face in diagnosing and treating cancer in Bhutan?
Yeah, there are many challenges. Although we had a flagship program, during those days, actually awareness was quite good in the public about the cancer. Many people came for endoscopy, but over the time, once this flagship has gone, then this screening program also has come down. So main problem is that the distance. People are very far, then they have to come to the hospital for endoscopy, then they have their own work, they have to spend money to travel to the hospital. These are the challenges. Sometimes other challenges are that myths and beliefs.
Yes.
If you go to the hospital, if you get operated, then you will die. So because of the fear, many people do not like to come to the hospital. So once this cancer is detected, again if we tell them that operation is the option, then they deny because they fear,
Yes.
because they would have already told that if you get operated you can die. And another is once cancer is diagnosed, the journey is very long, because operation, recovery, chemotherapy, radiotherapy, that may take around 1 year also. So when we discuss about this treatment option, then some of the patients do not turn up for the follow-up next time.
Yes.
These are the challenges.
Yes. So, doctor, are there any different challenges that you face in treating and diagnosing cancer in Bhutan?
In addition to what Dr. Prabhat said, I agree with whatever he said.
Yes.
So when it comes to cervical cancer, another challenge is the women, they usually recognize the symptoms,
Yes.
early symptoms, but still out of fear of diagnosis of cancer and out of embarrassment
Yes.
to get checked by the doctor. So this commonly leads to the delay in diagnosis.
Yes.
And other challenges is, though the patients come with early symptoms, there are some challenges from health workers. Some of us are not aware of the symptoms, and some of us do not properly examine the patient. So there are challenges from both the sides. And for this reason, today we are here to observe the World Cancer Day, where we would like to remember those patients who lost their life
Yes.
due to cancer, and those patients who face the challenges and who could overcome the cancer, the survivors,
Yes.
and to create awareness for early detection, timely treatment, in general to reduce the cancer burden and improve the quality of life of the people.
Yes. So, doctor, it is known that the low and middle income countries suffer significant burden of cancers compared to other countries who are doing well in terms of health care systems. So, in the low and middle income countries, we lack or we have limitations to access to diagnosis and quality treatment. So Bhutan being one of the middle income countries and suffering the sharing the burden of cancers, how can we improve the accessibility and affordability of cancer diagnosis and quality treatment, which ultimately will increase the survival rates?
Yes, in many poor countries, the accessibility and quality of services is a major issue, and same is with Bhutan.
Yes.
But Bhutan is unique in a way, and we are a little ahead of many developing or poor countries. Let's say in terms of cervical cancer,
Yes.
we have already achieved 90, 70, 90 strategies towards elimination of cervical cancer by 2030. So the main challenges we have is to sustain this achievement and to improve the quality. So we do have numbers achieved, but we are still working on the quality. So even if we have numbers achieved, and if we do not take this quality into account, we are on a long way to achieve our dreams. And other thing is, as you said, the people accessibility, because not because of the communication or transport, because they are not motivated to come in Bhutan because of cultural barriers, because of myth, so they do not usually present. And we have all the services, and it is provided free of cost, unlike other countries. For example, if you take our neighboring countries, by the time you die because of cancer, your relatives or you have sold all your properties, and when you go home, when you are about to take a dead body, you are below poverty line. So in a way, because of our king, we are so lucky that we do not have to face all this problem. So Bhutan is, I would say, in a better position than many other countries at the moment.
Yes. So, Dr. Prabhat, how well our hospital or our healthcare system is equipped to facilitate individuals who are coping with psychological and emotional burden of cancers?
Another aspect is emotional breakdown of this patient who are diagnosed with cancer, because in my experience I have seen few of the patients, when I say that you have cancer, they just say that I am going to get suicide. So these are the things they suffer. So for them what we do is family support is very important, counseling We give counseling to the family as well as to the patient also. Then if the symptom is severe, then we take help of our psychologist. We have palliative team also, where many aspects of this the psychological aspects they take care, where they go to their own home, patient's home, and they speak with them. They give support in various aspects, and these are the ways that we are trying to tackle these emotional things.
So, doctor, what's the role of palliative care?
So palliative means now when patient is at stage 4 disease, there are not many options curative options that we can offer to them. So they are like not many days left for them. So to make their life comfortable till they leave, their suffering is reduced. For those, this palliative team come and take care of those patients. Suppose they are bedridden patient also need care. They pass their stool, urine in the bed only. So how to take care of hygiene part, and if they are not able to eat, what options are there? They discuss all those things. How to give, whether they can take orally, or should we put a pipe inside, or should we give IV fluid? Then if they suffer from severe pain,
Yes.
then we have different types of painkiller. Which painkiller is good for them? If they have obstruction, block in the intestine because of advanced cancer, what options they have? So all these things are taken care by a palliative team.
Yes. Yes, thank you, doctor. So finally, since we are nearing the end of our episode today, I'd like to ask both of you to give an advice on how individuals can contribute to the fight against cancer, both in terms of its prevention and supporting those diagnosed, and also your hope for the future of cancer in Bhutan.
So let me take the chance.
Yes.
So cervical cancer is 100% preventable and 100% curable if we diagnose at early stage. So for this, I would like to encourage all the girls and boys to get vaccinated, and all the girls, women, to come for routine screening. And if you have any symptoms of cervical cancer, please visit us at the earliest. And I would like to mention about the common challenges, the collusion, meaning that the family members do not want to share their diagnosis to the patient, and it is quite a challenge. It's a big challenge. So I would like to request everyone to share the information of cancer diagnosis to a patient, because this helps in diagnosis and treatment. Slowly the patient will get adapted with it. So finally, I would like to thank PBS2 for allowing me this opportunity to come here.
Yes, yes, doctor.
So lastly, the important message that I want to give to public is once you reach this age, 50 years of age, whether you have cancer or no cancer, whether you have symptoms of cancers or no, you have to come and do the basic investigations to diagnose the cancer, like breast cancer, lung cancer, esophageal cancer, stomach cancer. There are screening tests that can be done, simple tests that can be done to detect the cancer in early stage. If after doing all the tests, if your reports are normal, then again repeat this screening test after 3 years. It is similar to maintaining your car and all, because every time and again you have to go to the workshop and maintain so that you don't land up in accident. Similar to that, our body also need maintenance. That is what I want to say. Thank you so much.
Yes, thank you so much. So with this, we are wrapping today's episode, which is dedicated to observing World Cancer Day. And I thank you both, the doctors, for your time and invaluable insights on cancer. And I hope today's episode was helpful to our audience and viewers at home in knowing about the importance of early detection of cancer and the current state of cancer care in our country. And that is all. Thank you so much for tuning in. Until next time, take care and goodbye.